When I'm happy, he's happy. When he's happy, I'm happy. And I think that going through this program will do that for us.
Our goal is always to help with keeping patients in the home because we know patients do best in their home and with their loved one.
Most people know what hospice is, but what's palliative care? And palliative care is really, a patient isn't ready for hospice, but they have a lot of challenges and they need support.
Hospice of the Valley is pioneering a better way for families to care for loved ones suffering from dementia. The palliative care program is an important way to support well-being by keeping families together at home. But when it became clear that caregivers in the new program were experiencing stress that was tough to handle, St. Luke's Health Initiatives quickly got on board to assist.
What it will do is really let us teach the caregiver how on their own they can really do things that can help them deal with the unique stresses of being a family caregiver for someone with dementia.
St. Luke's Health Initiatives is providing the funding for a breakthrough application of mindfulness-based stress reduction training. Family caregivers attend a 6-week course to learn the best ways at home to care for their loved one and themselves in dealing with dementia.
It's like the stars were aligned. It was really amazing because they said, we know this is a piece that needs to be there if we're really going to have the kind of impact that we want to have, both on the quality of care for the patient, for the family member, and for the system as a whole. Most funders, with good reason, want to know that what they're investing in is research-based, evidence-based, is going to work for sure. And this gave them the opportunity to test their hypothesis. They think they've done all their homework, their experience tells them this will work, but they don't have any guarantees. And so there's a risk that's involved from the funding perspective.
The mindfulness training is really to support the caregivers and helping them become aware of things spiritually, physically that's going on in that role of caregiving, because it takes a lot out of someone in all of those realms.
I'm very adamant about the fact that we want to stay in the home together. It's just much easier for us. If Bill was not at home, it would be a very stressful situation, not only for him, but for me.
We do have an appetite for making big change, and to do that we have to do it in partnership with other organizations. And this model, we believe, allows us to identify where those big levers are that can really make a difference, make transformational change in the healthcare delivery system. And seeing Lynn and Bill in their home, and Lynn talking about, her one-liner was, when Bill's happy, I'm happy, and when I'm happy, Bill's happy. That did it for me.